Jealousy delusion. Jealousy, known for its destructive nature that can erode love and marriages, takes on an altered form when it becomes a delusion. Welcome to an exploration of the fascinating realms of delusion, hallucination, and the intriguing phenomenon of jealousy delusion. Delusion and hallucination are intriguing psychological phenomena that can significantly impact an individual's perception of reality. Delusions involve holding on to false beliefs or perceptions despite evidence to the contrary, while hallucinations involve experiencing sensory perceptions without corresponding external stimuli. However, within the realm of delusion, one particular type stands out: jealousy delusion. In this discussion, we will delve into the complexities of delusion and hallucination, and specifically examine the dynamics and consequences of jealousy delusion, shining a light on how this particular variant can profoundly affect individuals and relationships. Delusion and hallucination. Delusion is a false belief or perception that persists despite evidence to the contrary. It involves holding onto an idea or belief that is not grounded in reality. Delusions are typically fixed, resistant to change, and can have various themes such as paranoia, grandiosity, or somatic concerns. They are commonly associated with psychotic disorders like schizophrenia. On the other hand, hallucination refers to perceiving something that is not present in the external environment. It involves experiencing sensory perceptions without any corresponding external stimulus. Hallucinations can occur in any of the sensory modalities, such as hearing voices, seeing things that are not there, or feeling sensations on the skin. Unlike delusions, hallucinations are transient and can vary in content and sensory modality. They can occur in a range of conditions including psychotic disorders, substance-induced disorders, medical conditions, and as side effects of certain medications. In summary, delusions are false beliefs that persist despite the evidence, while hallucinations are sensory perceptions without corresponding external stimuli. Delusions involve fixed, irrational beliefs, while hallucinations are sensory experiences that occur in the absence of actual sensory input. Delusions are associated with psychotic disorders, while hallucinations can occur in a variety of conditions. Jealousy delusion, also known as delusional jealousy or morbid jealousy, is a specific type of delusion characterized by an irrational and unfounded belief that one's partner or spouse is unfaithful or involved with someone else romantically, despite a lack of evidence to support such claims. It is an extreme form of jealousy that goes beyond typical feelings of insecurity or suspicion. The nature of jealousy delusion involves an intense preoccupation with imagined infidelity, leading individuals to interpret innocent actions or situations as evidence of betrayal. This delusion often stems from deep-seated insecurities, past relationship traumas, or underlying psychological issues. Characteristics and symptoms of jealousy delusion include: 1. Unshakable belief. Individuals with jealousy delusion firmly hold their beliefs about their partner's infidelity, despite evidence or reassurances to the contrary. They may dismiss any logical explanations or alternative perspectives. 2. Pervasive thoughts and behaviors. Jealousy delusion consumes a person's thoughts and may lead to behaviors such as constant questioning, surveillance, snooping, or excessive monitoring of the partner's activities. 3. Emotional distress. Jealousy delusion is typically accompanied by intense emotional distress, including feelings of anger, betrayal, sadness, and anxiety. These emotions can significantly impact the individual's well-being and their relationships. 4. Interference in relationships. Jealousy delusion can cause significant strain on relationships. The affected individual may become controlling, possessive, or confrontational, which can lead to communication breakdown and a loss of trust. 5. Persistent doubts about the partner's faithfulness, despite a lack of evidence. Constantly seeking reassurance or proof of loyalty. 6. Interpreting innocent behaviors as signs of infidelity. Experiencing extreme emotional distress and agitation related to the delusion. 7. Social withdrawal and isolation due to suspicion and mistrust. Engaging in surveillance or intrusive behaviors to gather evidence of infidelity. It is important to note that jealousy delusion is a psychological condition that requires professional intervention and treatment. Individuals experiencing jealousy delusion should seek help from a mental health professional who can provide appropriate support and guidance to address the underlying issues and manage the delusional beliefs. When a spouse is suspected by a jealous party, it can be a challenging and delicate situation to navigate. Here are some recommendations on how the spouse being suspected can react. 1. Remain calm and understanding. The spouse needs to respond to the accusations with calmness and understanding. Reacting defensively or angrily may escalate the situation and further fuel the jealousy delusion. Instead, approach the conversation with empathy and patience, recognizing that jealousy delusion is a psychological condition that requires support and professional help. 2. Open communication. Engage in open and honest communication with the jealous party. Encourage them to express their concerns and fears, and actively listen to their perspective. Responding with empathy and reassurance can help alleviate their anxiety and create an environment for more meaningful dialogue. 3. Provide reassurance. Reassure the jealous party of your commitment and fidelity in the relationship. Offer evidence-based explanations for any behaviors or actions that may have been misinterpreted. Reaffirm your love, loyalty, and dedication to the relationship, emphasizing that their suspicions are not grounded in reality. 4. Encourage professional help. Suggest and encourage the jealous party to seek professional help from a mental health provider. Jealousy delusion often requires therapeutic intervention, and the guidance of a trained professional can assist in addressing the underlying insecurities and distorted thinking patterns. 5. Set boundaries. While it is important to be understanding and supportive, it is equally essential to establish boundaries. Communicate what behaviors are acceptable and what are not. Boundaries help protect both individuals in the relationship and foster a healthy environment. Discuss together what actions or strategies can be put in place to rebuild trust and manage the jealousy delusion. 6. Seek couples therapy. Consider engaging in couples therapy together. A qualified therapist can help facilitate productive conversations, guide healthy communication and trust-building exercises, and assist both individuals in understanding and addressing their respective needs and concerns. 7. Patience and time. Overcoming jealousy delusion takes time and patience. Recognize that progress may be gradual, and setbacks can occur along the way. Encourage the jealous party to engage in self-care activities, such as therapy, support groups, or pursuing personal interests, to aid in their healing process. Remember, each situation is unique, and these recommendations may need to be adapted to fit specific circumstances. It is essential to prioritize emotional well-being, seek professional guidance, and work together as a couple to navigate the challenges that jealousy delusion presents. Thank you for taking the time to watch this video on jealousy delusion. We hope that it has provided you with valuable insights and understanding about this complex psychological phenomenon. Remember, jealousy delusion is a challenging issue that requires empathy, patience, and professional intervention. If you found this video helpful, we invite you to subscribe to our channel for more informative content on various mental health topics. Don't forget to check out our Health Concerns playlist. Thank you once again for watching, and we appreciate your continued support.